Alright folks, let's dive into Horner syndrome, a rare but important condition. Clinically, it presents with three classic symptoms: ptosis, miosis, and enophthalmos. Remember, ptosis means drooping eyelid, miosis is pupil constriction, and enophthalmos is the sinking of the eyeball into the orbit. Horner syndrome results from disruption along the sympathetic nerve pathway, which has three neurons. The first neuron starts in the hypothalamus of the brain, travels down the spinal cord, and synapses in the ciliospinal center of Budge, located in the C8T2 region of the spinal cord. The second neuron ascends from the ciliospinal center to the superior cervical ganglion, located at the level of the C2-C3 vertebrae in the neck. The third neuron then runs from the superior cervical ganglion through the carotid sinus to the eye and face. Disruption at any point can cause the syndrome. Now, let's talk about some causes. Otitis media, or a middle ear infection, can affect the pathway. Apical lung cancer, particularly Pancoast tumors, is another culprit. And don't forget carotid dissection, where a tear in the carotid artery wall can impact the nerve. For diagnosis, aproclonidine eye drops are a key tool. They work by dilating the pupil in the affected eye, confirming the diagnosis. Horner syndrome might be rare, but understanding its presentation and causes is crucial. Trauma to the neck or chest can also lead to Horner syndrome. Additionally, an aortic aneurysm can compress the nerve pathway. In children, neuroblastoma, a type of cancer, can also be a cause. Cluster headaches, though less common, are another associated condition. Post-surgical complications, especially after thyroid or neck surgeries, can sometimes result in Horner syndrome. Lastly, strokes affecting the brainstem can disrupt the sympathetic pathway, leading to the syndrome. Other tests include imaging studies like MRI or CT scans to pinpoint the cause of the disruption.